Hi everyone, Megan Collier here from the Texas Tech University Health Sciences Center Marketing and Communications team. We've got another great interview for you today. One good thing that has happened during the COVID-19 crisis is a lot of people have come together to really make a difference and help their neighbors and help the community. And that's something that we're going to talk about today with Dr. Simon Williams from a new collaboration here at Texas Tech University Health Sciences Center, the West Texas 3D COVID-19 Relief Consortium. Thanks for joining us today, sir.
Hey, you're welcome. Glad to be here.
So before we talk about the consortium and this project, and it is a widespread, far impacting project that you've started, I want to talk about what you do during your day job and sort of what your impact is at Texas Tech University Health Sciences Center and kind of how you got here.
Yeah, so I'm a professor of medical education. I'm the Associate Dean for Academic Affairs in the School of Medicine. So during the day, I spend a lot of time trying to think about how do we actually maintain the educational program within the School of Medicine, which I oversee. So all the things that are impacted by the fact that our didactic classes are occurring online, which was not our prior way of doing things, and the fact that our clinical students are not actually in clinical rotations. So we've been working diligently to try to make sure we can keep those students progressing. We've got a class that's about to graduate in a little bit over a month. So that's what I do during the day.
I noticed that you have a bit of an accent. You're not from West Texas, I presume, huh?
No, I arrived in West Texas in 1995, but I'm originally from Ireland. I grew up there, went to college in genetics in Trinity College in Dublin, and then moved to the States when I was in my early 20s. Got a Ph.D. in genetics and molecular biology and did some work at the National Cancer Institute as a postdoc, and then moved here to Lubbock to take a position in the Department of Cell Biology and Biochemistry. And then about 12 years ago, I moved into the administrative world where I thought that it was important that we train good doctors for the future.
Absolutely, very important. So let's talk about this project, the consortium that you have going. Sort of what was your inspiration? How did it come about?
Well, we had already been working with our College of Engineering to develop a dual degree program that combined medicine and engineering. So I had pretty close contacts with Dean Al Sacco and a few of the other faculty over at engineering. And then one day I was on a phone call to which was basically all the senior education leaders of all the schools of medicine. And a person from Carle School of Medicine up in Illinois mentioned, that's a school that already has a close connection between engineering and medicine, and mentioned that they were thinking about starting some projects together to address some of the issues that they were seeing, shortage of PPEs and things like that. And I thought, well, my goodness, we've got some great folks over in engineering. Let me reach out. And I reached out to Al Sacco, and he was immediately on board, and we started thinking about projects. Now, at that stage, we realized that there was a lot of other things already going on. We had students making face shields. We had the Honors College over at TTU already coordinating teams of students. And so we thought, well, we can actually put something together that brings together all these grassroots efforts and make something that is even better and more organized. So that's really how it got started. It started really about 4.5 weeks ago with about 10 people just talking, and we've grown, and we will explore how we've grown over all of West Texas since then.
I mean, that's what's huge, right? It's not just in Lubbock. You've branched out to a lot of different areas and a lot of different avenues, not just medicine, not just engineering, right?
Yeah, so the first group that really we got in touch with was a group of folks down in Odessa and Midland. And this is where we started working with University of Texas Permian Basin, which is not a college or university I think we've worked with very much before. And so the College of Engineering, George Nana is the dean down there. And he immediately got in touch with us and said, hey, can we start working together? Because we also have groups of people down in the Permian Basin. And so he and a guy named Mark Merritt, who owns a plastics company down there, and subsequently all the folks at TTUHSC down in Odessa have come on board. And they are truly amazing group of community organizers that are a huge part of our consortium right now. And then from there, we realized that covered Lubbock and the Permian Basin. And we have now contacts up in Amarillo. We have a group down in San Angelo that's at San Angelo State. And we have some communications out into groups in Abilene, which is an important part of our group. And then just last night, we actually got in touch with an El Paso group, which is, again, a conglomeration of different small groups that have come together. El Paso Fighting COVID is one of those groups. And so they're doing amazing things down in El Paso. So at this stage, we can sort of say we're covering pretty much West Texas from east to west and north to south. So we feel pretty good about the fact that we can have impacts throughout the area.
I mean, I think that's my big takeaway from this is you've really been able to unite efforts and direct things in a way that's productive, right? So that we can, maximize all of that knowledge and maximize those efforts, sort of streamline things, right? I think that's really cool.
Absolutely, and what we started off with doing was printing the brims for face shields because we recognized that those would be immediately impactful. So as we started doing that, one of the first things we had to do was organize that, make sure we were printing the right with the right material and the right design, and there's a whole variety of designs out there. So we were able to bring together this group of printers, and we've got people. I'm at the Health Science Center right now. Over in the library, they got 3D printers. Over at TTU, they've got in engineering, in architecture, just people who have 3D printers at home. Yeah. Suddenly we had this sort of army of people who said, I can do that. We have been able to get some of the other materials. The face shield material, the clear plastic, is actually pretty hard to find. So we've been, we had this interesting story a few weeks ago where Cindy Morris, who works in development here at TTUHSC, found some of this clear sheet material in San Antonio. And she said, I can go get it. And she said, so she went and got it. She brought it halfway to Odessa, and it was picked up by one of the guys down in Odessa, Gilbert, who brought it then all the way to Odessa. And then I drove down to Odessa. I met him there. And so we had this 3-stage convoy of handoffs, secret handoffs throughout West Texas that got us the material that allowed us to make another 2,000 shields here. Then another connection we had into ExxonMobil, which was facilitated by Ron Cook here in Lubbock, has got us huge sheets of this material that also got picked up in Temple, in Abilene, shipped to Midland, was then brought to Lubbock. We handed off one large structure here in Lubbock, and then the rest of it went back to Odessa so that they can complete their projects. So a lot of innovation, a lot of organization, and a lot of driving around West Texas. We're all used to doing.
You mentioned driving, but I also hear there's some aviation involved as well, right?
Yeah, this is one of the most amazing things. So, what we realized was that we had to have a plan. We had to be able to say, we can recognize a need. And so we came up with a plan. And one of the first things we focused on, and I'll tell you a story in a minute about one of our rural hospitals. But one of the things we recognized was that our rural hospitals needed some help. We wanted to be able to give something to those rural hospitals, give them the confidence that if they were exposed at a sudden influx of COVID-19 patients, that they'd be prepared for that. But some of those hospitals are a fair distance away from where we are. So 2 different groups, one group called the West Texas Aviators, which is just a group, a loose conglomeration of people who have planes, who love to fly. I guess at the moment, gas is a little bit cheaper, so they love to fly even more. And then the Angel Flight folks located here in Lubbock, who have, as people drive less, there's fewer accidents. So they were doing less of what they were normally doing. So we've been able to basically ship materials out to remote areas very easily in planes. The other thing that's really been cool is we're also working with our Lubbock County District Attorney's Office and a guy named Todd Smith. And what he's been able to do is say, there was something like, I don't remember how many it was, 14 hospitals that were in the region that surrounds Lubbock. He said, you don't need to fly to all those places. I've got folks in the district attorney's office. And so one day last week, we were able to with 4 different people, deliver to every single hospital in the Lubbock area. Then this week, he's been able to help us to do that for all of the hospitals around Amarillo. So at this stage, for every rural hospital around Lubbock and Amarillo, we've been able to deliver 20 face shields, which in many cases, maybe the only face shields they actually have in those hospitals. And then we've also delivered 2 to 3 of what we call intubation shields or aerosol chambers. And these are plexiglass boxes that you basically put over a patient's head. There's armholes for the physician or the nurse or the respiratory therapist so that they can safely work with patients who are COVID positive and not have that major exposure risk. So we have now covered the Amarillo region, the Lubbock region, and we here in Lubbock very soon will meet the needs of all of the hospitals in the area around Wichita Falls. And that includes the major hospitals in Wichita Falls who we've already delivered to, but then the rural hospitals around there. And then also we're going to cover all of the hospitals around Abilene. And then our group down in Odessa is meeting the needs of all of the hospitals around Midland, Odessa, all the hospitals around the San Angelo area, and that includes all the way down into the Big Bend area. And then our colleagues in El Paso have already covered a lot of the needs for hospitals in the El Paso urban area. And then we're going to cover all of the smaller hospitals. There's not as many down there around El Paso. And what's sort of cool about that is that the El Paso group, they have the ability to make face shields and they're making face masks, but they didn't have the ability to make the intubation chambers. So we have 50 intubation chambers ready to go from Midland, Odessa, that will be shipped over to El Paso, and they'll be able to deliver to all of the hospitals over there. So it's a true
That's incredible.
Cross West Texas community effort.
The logistics of that are mind-blowing, to be perfectly honest, right? Like, I mean, that is crazy. That's wonderful, wonderful work. You talk about the face shields, you talked about the chambers. Any other things that y'all are kind of working towards creating with this?
Yeah, so one of the things that we've been working on is a standalone sort of emergency ventilator. So one of the things that we're concerned about is, will anywhere become overwhelmed in terms of having the right number of ventilators, which is what we hear coming out of other parts of the country. So we have a group over in mechanical engineering over at Texas Tech that are developing 2 different models of these standalone ventilators. Now they'd only be used in an emergency, and they'd help to keep a patient ventilated for a period of time until they can be brought to a major referral hospital, which is what the plan would be. But we don't want anyone to feel like they don't have the capacity to look after a patient if it's an emergency. And what's really cool about that project is one of the 2 models was developed by a high school junior at Friendship High School here in Lubbock. And it's based on the machinery and the parts that robotics teams use to build robots in high school. Well, unfortunately, those things aren't really happening at the moment. So there's a lot of those pieces of instruments sitting around. So this young man has actually developed a plan where he can deliver instructions to any small high school group. Now they wouldn't be at the high school, obviously, throughout West Texas. And we can actually have those individuals can potentially now build these ventilators as a project. Hopefully they'll never be used, but what an amazing use of sort of engineering thought at a very young age, and materials that are already in place in a lot of these communities. And that's one of the other things that we think is really important about what we're doing. So a lot of these rural hospitals, they may not have been very well connected into some of the major centers. And what we are trying to do is use our Rural Health Institute, use our area health organizations to really build these relationships a little bit better, so that they may be centers for entrepreneurship in these small communities for these young future engineers. I hope a lot of them will go on to that kind of career. so that even once COVID is done, and hopefully that will happen, although it probably will be some time in the future, we will have even better connections that we can build future relationships into these small hospitals. And I wanted to just tell you this one story about Ward Memorial Hospital, which is in Monaghan's, which is about 60 miles west of Odessa. So when we had our first meeting, one of the most inspiring stories was by a guy named Don Hillman, who's an emergency medicine doc down in Monaghan's. And he told us about his small hospital, which is actually one of the better prepared hospitals, and I think partly because of him. But he explained that in his hospital, they had about 60 people who worked there. They did not have enough face shields for those individuals. They had one ventilator, which was a transport ventilator. So it was really hearing that in-person story. One of the first flights that went out, delivered materials to Don Hillman in Monaghan's. And we were also able to cover at that same trip Reeves County Hospital, which is in Pecos, which is just a little bit further west of there. But it was really hearing that story that sort of raised this idea that, boy, we can make, with very little effort, I mean, no, I shouldn't say that. People are putting in a tremendous amount of effort, very, very little effort on my part, frankly, maybe. But there's people out there that are just printing away and assembling. But with a small amount of donated material, we could make a difference for that small hospital. And that was where we actually got the idea that we needed to help those hospitals.
Well, how can we help you guys? There's a crowdfunding effort, I understand. If people are watching this and they're inspired to give, and maybe even donate materials and things like that too, right?
Yeah, so we've been very lucky. We've got a lot of people who have already donated money to us. We recognize, a face shield, relatively cheap thing to make. We can make one for about $10 for materials and assembly. We have had some people who've even donated face shields directly to us that they found elsewhere. One of the things that helps us with is that we don't want to just focus on our healthcare workers. We want them to be well because we need them to be well to look after us. But there's also whole other groups of people who we want to help. So we're looking at law enforcement. We're looking at first responders. We're looking at the people who are still working out in Market Street or United or Target or wherever they happen to be. We think that we can help a lot of those folks stay well and stay protected so that they can help us. So we have, we can certainly make more face shields, and we actually now are trying to ramp up our production of face shields so we can even get out to people who work in nursing homes, because we recognize that that's a major risk factor for those nursing homes. We think that we can build these ventilators for about $600 each, which will give us a machine that will give the confidence to a hospital to say, we're not going to run out of ventilators, or at least we can keep people alive for a little bit longer if we need them to be transported. So if people would like to support us, we certainly, our crowdfunding site is one place, and hopefully you can maybe share that link for folks. And we've had people donating and finding the materials, because some of those materials are a little bit harder to find. But we certainly are very thankful for the generosity of those who have already contributed. We've raised several tens of thousands of dollars already, and we've spent a fair amount of that money already. So we're certainly going to hope that we're going to be able to maintain at least some level of fundraising to keep this going. We anticipate that our work won't be done very quickly. So we expect that once we have met our initial goal of supplying materials to each hospital, we're going to go back to them. Because one of the things that's really makes us feel really good is that we get these thanks from people who receive our materials, and then they say, when can I be next on the list for another shipment? So we're keeping going. We're not going to stop. We want to make sure that people are protected as well as we possibly can. And so we anticipate maintaining this activity for some time, which is why we're also looking at new innovations, things that we can keep distributing. few other things that we're working on. We have a group which is also more a collaboration here at the Health Science Center. We're working on sterilization techniques for the N95 masks that the docs and nurses and others need to wear to keep protected. So those are in short supply. So if we can re-sterilize them, there's already a project going on that Min Kang here at the Health Science Center is developing. And we're also looking to see whether we could come up with a way to make small kits that small hospitals might be able to use to sterilize their own N95 masks, because we know that they certainly are in short supply there. We're looking at, there's a model of a sort of a respirator hood, which is sort of like a diving hood or diving helmet that people use for diving that can protect the patient, keep, if a COVID-19 patient, keep any infectious agents within the helmet. That keeps the doctors and nurses and respiratory therapists much safer, decreases the spread of infectious material. So we're looking at lots of different types of projects.
And it sounds like these projects could continue well after the current sort of crisis is over, moving on to just, and it might evolve into something different entirely, right?
Yeah, so as we have distributed, say, for example, the intubation shields, one of the things that we've got feedback is, well, this is great if I'm putting it on a bed that's sitting flat, which is what normally, but under certain conditions, I may want to move that patient, and I can't have that box falling off. So we're receiving feedback about, can you put clamps on them that would help them stay on the bed? And we have some people saying, well, the shape doesn't quite work the way that we would use it. So we actually have two different models. We have a more rectangular model that we actually make here in Lubbock, and then there's a different model that has more space that's made down by the Odessa group. So we're actually thinking about, well, maybe we need to give each hospital one of each so that they can pick and choose. In one location, one model works better, in another location, another model works better. The other thing that they've actually set up over in engineering is actually a testing center where we can test the masks that people are producing. So there's lots of people around who are sewing masks. Mm-hmm. So we've actually been able to come up with a method whereby we can test the filtration properties of different masks, and we can now give some guidance on which kind of mask would be good, say once we all have to wear masks outside, what kind of mask should you be wearing out there? But are there also some masks that would be better suited to a healthcare setting, or even in some of the models, they actually look like they might even be almost as good as an N95 mask. So it might be a good replacement if N95 masks end up being in even shorter supply.
Really, really interesting. And we will definitely put a link up for that crowdfunding campaign in our comments. You guys have a website as well though, right?
We do. I've been happy that folks at communications and marketing here in the Health Science Center helped us put that together, so it actually looks way better than anything I could have produced. But what we've been trying to do is keep that updated so that people see what kinds of projects we're working on. We try to update it on terms of what we've been able to deliver, so anyone who visits could see, maybe a hospital in their local community has actually already benefited from it. We're putting links into our Odessa group so that they can really show what they're doing, and because there's things they're doing that are a little bit different from us. We're all equal partners. Now that we've connected into El Paso, we want them to be able to sort of show what they're doing. And what was really cool was when we were talking to the folks in El Paso, we realized that they were doing things that we weren't doing, so we're going to learn from them. And we were doing things that they weren't doing, and they can learn from us. We can share resources, because we're not trying to just focus in on one particular area. If something is needed anywhere throughout West Texas, we're hoping that we're able to meet those needs.
Well, that is so cool. Thank you for all the work you're doing. This is really incredible, and it's really inspiring, to be perfectly honest with you. It's really, really fantastic. So now we've got our second portion of our expert interview, and this will not be as inspiring, but we will learn a little bit about you, okay?
Sure.
It's the lightning round. Buckle up. Here we go. First question. This has been stumping some people. So crunchy or smooth?
So I'm not a big peanut butter, but I suspect I would like it to be smooth.
Okay, all right, that's fair. Favorite ice cream flavor?
The cookie dough
Oh,
ice cream, that's my favorite.
very good. Okay. Are you binge watching anything right now?
You know, I really haven't had much time to do.
You've been busy.
My wife is the big binge watcher, and I was just watching a show with her yesterday that I found fascinating called Unorthodox.
Okay. I don't know if unorthodox. Perhaps I will investigate. First concert you ever attended?
Okay, so my first concert was in 1976. It was in Dublin, and it was the Stranglers, which was a really cool punk band at that time. But what most people find most exciting about that is that the support band was this unknown group called U2.
I knew you were going to say it. I knew it. I just had a hunch that you were going to say U2. That is so. Now, what year was that again?
1976.
That is
I
crazy.
was 15 years old. So.
That is so cool. What a cool story. Well, thank you so much for talking with us today. I am so inspired by the work you guys are doing. Keep up the good work, and we are certainly grateful for you.
You're very welcome. And I hope that you get the story out that I'm simply one person sitting in a chair most of the time. There's a huge number of other people who are actually doing the work, and they deserve all the credit. And I hope that maybe you can even talk to some of those folks as well.
Dr. Williams, thank you so much for being with us today. We appreciate it.
You're very welcome.